colleague. Thank you.
Hi, everyone. So I think one of the things over the last 2 days is, as everybody stands up, it becomes really apparent that the similarities, even though the place that we're starting at is so different, it really becomes a big part of what we're trying to do. So what we thought we would look at was this thing that we've been calling a digital spark. So as with Cyprus, we're late to the party as a country, but also as with Cyprus, suddenly we've been able to start moving forward and doing things differently, and I think that's really important. So what I'm going to talk about today is the concept of some of the things that Ireland is doing, and then ask a colleague of mine, Maria, to come and tell you about how we've engaged people in that position and how we've moved that. This concept of a hospital without walls or a liquid hospital springs to mind as an outcome of where we'd like to get to. If you imagine a patient coming into A&E in a hospital, and instead of the patient having to move around the hospital as they became iller, as they needed to go to specialist areas, but actually the walls of the hospital changing around the patient. The first room the patient comes to is the room they stay in for their journey in the healthcare experience. Imagine the experience of the patient if that could happen. Out in Buffalo in the US, that has been something they've built. Now, Ireland will take a long time to get to this kind of delivery, but this concept right through to the colleges and clinicians of Ireland of a liquid hospital or a hospital without walls is the driving force for our digital fabric, our eHealth agenda. And for me, if you have a patient at the center of that, truly at the center of the healthcare experience, the care will be more efficient, more safely delivered, and will reduce costs. We're trying to put these three words at the center, trying to make sure that we consider the patient, the clinician, and the public. In Ireland, we have been talking about patient-centered care, integrated care, and yet we deliver a care using a room similar to my colleague from Cyprus there, full of papers. I think we've probably got photos of ours as well on the slides later. But putting the patient at the center and delivering them what we're now moving towards around contextualized care is a big part of where we need to move to. If we can not only move to a point where the care is based on information about the patient, but actually the context they're in, then the experience will be different. We sometimes forget about the patient because we're focused on delivering digital solutions to clinicians. And I think that's becoming, how do we put our clinicians at the center? Creating and copying and utilizing the role of a chief clinical information officer in Ireland has been a huge part of what we've tried to do. How do we actually make sure that a clinician can impact upon everything that we do? But also we forget about people who are well. There were a number of corridor conversations yesterday that I was part of or overheard where we talk about healthcare systems being sickness systems. Healthcare systems are about the people that are ill rather than keeping people out of hospital. And we do really believe that a digital fabric and eHealth solutions can facilitate information to the people of Ireland to keep them out of hospital. You'll have seen these words on this slide before, but there is an element of learning, and I think that's one of the themes that I picked on yesterday and through today, is that we could all go away and just do it how everybody's done it before. I'm not Irish. I came from the UK 2 years ago to Ireland to deliver the eHealth agenda in Ireland. My experiences would be in the National Programme for IT in England, in the NHS. We mustn't make the mistakes that other countries have made, learn from those mistakes, and importantly, those successes, and keep delivering in the right way to get that done. I mentioned already this concept of a chief clinical information officer, clinical leadership. As a chief information officer of a country, I stand on this stage and others and say, no more IT projects. It's kind of a weird and odd thing for a CIO to do. But what we mean by that is very much how do we make sure that we have clinical leadership. Across Ireland, we now have 220 clinicians across 45 different clinical disciplines who have that mantra of no more IT projects, who come forward and say, I will lead the delivery of digital health in Ireland across different projects, across different clinical capacities. They've driven forward our agenda, taking it away from tin and wires, innovation even, from a technology point of view, and actually are now driving it through clinical experience, driving it through putting that patient at the center of what we do. I'll hand over to Maria briefly now, who will explain some of the details around that engagement.
Hi, so I want to talk to you a little bit about the engagement that we're actually doing in Ireland.
And as we were speaking about yesterday, the world is changing very, very fast, and it is coming to healthcare. So there's 80% of the world's population are going to have mobile phones by 2020. That's an incredible amount of people who want to have digital healthcare at their fingertips. And even this year, there'll be over 500 million people who will actually use a healthcare app. And we do quite a lot of work with public focus groups, clinical focus groups, and patient focus groups around what they want or what they perceive digital health to actually be. And what we're finding is different people have different perceptions on what it is and what it could be. And we're trying to engage with these different people around what they think and trying to work with them with what they feel or what they think should be there. And what we find is that we need to look at people in different ways. So we find that people are either an evangelist, a skeptic, or a pragmatist. And this is actually my son. He's 6, and he decided to help me with my slides today. So when I was talking to my son Sean about an evangelist and what it actually meant, to him it was, yes, I'm getting chocolate. That's the face he pulled whenever I was trying to explain to him what an evangelist actually was. And what it is in digital connected health for us is someone who's enthusiastic for information, but sometimes they can put technology first, which is a negative as well. They need to realize that it's not all technology, that we are trying to do business change, not just IT projects. But they're brilliant at actually leading the way and leading the way for other people and talking about what they're doing and getting people enthusiastic. But they need to be careful as well, because sometimes that can come across as a eulogy and people can start to not listen to them anymore. But the good thing about evangelists is they learn lessons for others. They can go out there and see what they're doing and bring back lessons, which we're all trying to do here today as well, learn lessons and bring them back to our own respective countries as well. So when I spoke to him about being a skeptic, I talked to him about if he tidied his room, I would buy him a dog. And he didn't really believe me. And sometimes when we're talking to clinicians or the public or people in healthcare IT, because of their experiences with our digital connected health or their experiences in health generally, sometimes they don't always believe what we're trying to do. But these type of people are really important to have in our ecosystem because they focus on the benefits. Now, they can be suspicious of change, and that's warranted usually because of experience. But if you can actually talk to someone like that and get them to believe what you want to do and get them on your side, they're a really, really believable advocate. So they may be quick to see the negative in the different things that you're trying to do, but again, at that side, if you look at it that way, they're actually really realistic about what we're doing as well. And we have to remember all these different types of people have to work and engage together as well, and sometimes a skeptic can be slow to adopt any solution, which for the evangelist can be sometimes a little bit frustrating as well. So the last one we spoke about was the pragmatist. And this is when trying to get a 6-year-old to be pragmatic is actually really, really difficult. But I told him that it was something like we had to make a list. If we had to go and buy groceries, we need to make a list. And it's about considering the how, and people like this actually want all the detail now. So sometimes it's hard to get them moving because they want everything now before they can actually move forward. They are very considered, which is a plus, because we need people like this sometimes when the evangelists are maybe trying to go straight down the road. We need people like this to actually pull us back and look at what we're actually doing. They can be frustrating for other types, but again, they apply lessons for others as well. And what we've realized is all these different types of people have to come together and have to work together. Now, we don't know what the right ratio is to have for these different types of people, but I do know when Richard joined our organization 2 years ago, he spoke to our department, and there's 288 people in our department, and he asked them how many of them thought they were evangelists, and there was only one in the room who was an evangelist. So even for our organisation, it's something we're having to try and do, is trying to change the perceptions of people, but again, realise that different people have different ideas of what's happened and what's going to happen, and we have to try and get them all to work together. So one of the ways in which we're trying to do this is we're realizing that it's not just the normal ways of communicating with people that are going to do the job for us, and we're trying to look at different ways of actually engaging people inside our system, outside our system. And what we're doing is we're using Twitter really, really, really well to try and talk to healthcare professionals, to the public, to our patients. And we find it really, really beneficial in being open and transparent and actually creating relationships. So for us, Twitter has become more about actually creating relationships that we're actually bringing offline as well as having them online. And we do a thing on a Wednesday night called Irish Med Hour, and it's on from 10 to 11 every Wednesday night to try and be open for lots of different countries to get involved. And in the Irish Med Hour, people just talk about different topics and different conversations, and we have brilliant conversations with different people all around the world, trying to learn lessons from each other, trying to give advice on things that they've done and that we're doing, and trying to see if we can actually work together to make things better. So it's a really good way for us, we've found, to develop these relationships. And it's something, if you're available to do it between 10 to 11 on a Wednesday night, I'd really recommend you join it. And other ways we're trying to actually talk to different stakeholders and different groups of people is that we've realised one route is not going to be enough, and that different people want to hear things through different ways. So we have our website, ehealthireland.ie, and we're really committed to being open and transparent about everything that we're doing. So we have case studies up there about different projects that are happening within our ecosystem and projects that are happening outside of it. We have news items that we post like 2 to 3 times a week on different projects that are actually happening in Ireland as well. And we also have a list of our 10 strategic programs, and we have regular updates there as well, so that anybody can go on and see what's actually happening, because we really are committed to being open about what we're doing. We think it's going to help us gather trust with both the clinicians and the public as well. And we also there, about 2 months ago, decided that we had to look at different routes. Twitter works really well for us with healthcare professionals. We have a huge following with clinicians, and we're developing brilliant relationships there. But if we really want to raise public awareness and put digital health at the heart of the national agenda, we need to speak to the public. And we realised to do that, we need to do it on their terms, and they are like Facebook and Instagram. So about 2 months ago, we started up a Facebook account and an Instagram account, and they are growing really strongly, and we're finding great traction with public and patient advocacy groups as well. So one of the things that we didn't do too well in Ireland was actually engaging with startups. Historically, startups could get their businesses in the UK or in the US, and they just couldn't even ever get anywhere near the health service executive in Ireland. And it was something that we wanted to change. So we very purposely this year tried to start actually looking at different routes for startups to be able to get into the market. One of the things we do is a thing called health tech. So it's a mentorship program, a pre-accelerator mentorship program that we do with a company called the NDRC, the National Digital Research Centre. And what happens there is there's about 45 different people put in ideas. They didn't have to be businesses, but they put in ideas of how they could actually make a difference in health. Their ideas that we could actually look at to see if they could be grown to be businesses that would make a difference in the Irish ecosystem. And out of those 45 ideas, we took 11 different companies and matched them up with mentors and matched them up with people from the HSE, people from the business world, to try and see if those businesses could be organisationally scaled. And there's some amazing businesses that are going to be coming out of this health tech NDRC. The gentleman that won has developed a device that can fit into like a clutch bag, a Hermes handbag, and it actually analyses blood at the bedside of a patient. So it's pretty cool. And another thing we started to do as well was actually engage with startups in our community. Startups that couldn't find anyone to talk to in the HSE to talk about their ideas or what they were doing and how they could make a difference. So now once a month we have an innovation lead who goes around all the different counties in Ireland, and every Tuesday he meets with as many startups in that county as he can, and he advises them on how they could actually bring their idea to life more with the HSE. So if they have someone like a clinical sponsor that can actually support their idea, they actually can put through a business case, and if it matches with our strategic programs, we will work with them as a pilot to try and push their idea forward within our own health service executive, as well as trying to support them outside Ireland as well. And the last way we've been doing it is a program called QIC, which is the Quality Innovation Corridor. So we're very aware that clinicians that are actually working in our system are the ones with the best ideas of how to make things better within health. But what they don't have sometimes is the technological expertise. So we're trying now to match clinicians that have an idea with technology experts in our office. So very similar to eHealth Connect, they actually put through a business case and they talk about what their idea is, and we then try and match them with different technology experts in our area to try and bring these ideas to life. So we're finding it's a really way to increase agile engagement and bring new ideas and innovation to our Irish ecosystem in health. And we're really proud as well to be talking at the minute to the World Health Organization about these and many other ways that we're actually engaging the public, the patients and our clinicians. And we're actually going to be writing up a case study on health literacy and how we've actually did it in Ireland. So if you want to follow us on Twitter or check out our Facebook site, hopefully we'll be posting that in the next couple of months. So one of the things that Richard spoke about yesterday was personas and how we are trying to do things in different ways. And we're trying to create a digital fabric in Ireland. And one of the things that we're doing, which we all think is brilliant, is trying to do a personas project around the electronic health record procurement. So we're working together with lots and lots of different stakeholders and different groups and organisations to try and develop 20 different personas of people in Ireland. And these include healthcare managers, public people, patients, people with specific chronic diseases. And we're going to present these personas to the vendors that are actually going to be procuring for the electronic health record. So instead of them telling us what their technology can actually do for us, that you hit this button, it does this, if you go here, you can see this, we want them to actually come back to us and say, for all these different people, this is how our technology is actually going to work for them. So I think it's a really good way to try and engage people in a different way. I'll pass you back to Richard.
Thanks, Maria. Yesterday we spoke a little bit about giving more time, giving healthcare organisations 10 years, and a colleague from Cyprus there talked about his solution that took 9 years in procurement. We have similar experiences in Ireland. But one of the things we have to watch out for is the picture behind me. In Honduras, the country decided it would build a bridge. It took so long to build a bridge that the river moved whilst it was being built. We have to be very careful to keep an eye on exactly what's happening around us as we do those 9-10-year procurements, as we try to deploy electronic health solutions for the good of patients and putting that in place. So it's a stark warning for us that we have that to do. And the river maybe is an analogy for the gaps that we have as well. We've heard already, and we heard yesterday, that the gaps are widening. People are an aging population. The quality of care, the patient experience, how do we personalize that is something that only really technology can do. We took a decision in 2015 to run 3 projects called Lighthouse projects. Investments not insignificant in 3 disease areas that would use technology for Ireland to learn lessons. Quite large impact for us is the savings from those. In 2017, we forecast €5 million saving in drugs in epilepsy by sequencing the genome of children with suspected epilepsy and targeting the right drug immediately. In haemophilia, by delivering just-in-time treatment to the patient's home and connecting them to their clinicians, we can make huge savings, and over 3 years, €20 million has been saved. And across bipolar, by running a hackathon to create solutions for bipolar disorder, making the treatment of that illness easier and more centred. I'm very proud that this year Ireland launched its individual health identifier. Every person who lives in Ireland can now be uniquely identified across systems and linked to their clinical information that is held locally. We don't yet have an electronic health record at the centre, but we do now have the ability to associate a demographic information for every person, every clinician, and every healthcare organisation in Ireland. One of our biggest successes in the last year is to deploy electronic referrals. In 12 months, we've completed the implementation of electronic referral from GP practice to acute hospitals, forecasting a saving by the end of the year of just over €2.5 million in paper, in stamps, and in missing information. A referral in Ireland touches 16 pairs of hands from hospital to GP. By removing that, the patient sees the referral land before they leave the GP and walks away knowing that their referral is going to happen. The positivity that this has brought to the GP community and to the patients of Ireland is huge. Up to Christmas, hopefully that's the first mention of the Christmas word you'll get. We have 3 big things to do. Our first maternity hospitals go live with their electronic health record. Our first labs go live with its first national information system for labs. And we start to connect our 47,000 staff that don't have a digital identity, as well as being the first member state to have a cloud-first policy. Any new solutions deployed in Ireland have to be first considered to go to cloud. Just play a little video from a film. Maybe this is a situation we have now in Ireland. This is perhaps how Bruce Almighty gets hold of his clinical information. And maybe from the photos from Cyprus, they have a similar situation. Imagine trying to get at your information in this way, trying to find exactly the pieces of information you need. Very much a situation we have, and why our electronic health record procurement moves at pace now. We spoke yesterday about the costs and timelines, but the reality in Ireland is for €17 per person per year, we can remove the need to get at paper in that way. We can remove this amazing invention, the pink elastic band, which today in Ireland provides security to clinical information, makes sure that clinical information doesn't go missing, so delivers data quality. It delivers information governance because you clearly need permission to remove a pink elastic band from a brown folder, and delivers a data dictionary. Kind of terrifying that when a patient begins to understand that is how we deliver those things, the realization that, here's our picture similar to Cyprus, that this needs to change. This is a room in a hospital out west that is yesterday's, today's and tomorrow's emergency health information for one of our biggest hospitals. Trying to find anything in that room is very difficult. Trying to deliver integrated care because of the information in that room is difficult. In the end of 2014, we created a blueprint for what the EHR is in Ireland, how can that be delivered and how that works. Vendors from across the world were asked to indicate which of these pieces they could do. This is on the eHealth Ireland website and has been made available to other countries to try and add to, as well as steal the ideas that are on there. Between now and Christmas, though, we mentioned a number of things that need to be done. Our Director General, who I'm sure doesn't particularly like that picture of himself, is set those targets. We don't have targets from government in eHealth in Ireland, which is strange. So I work with our Director General to set ourselves priorities or challenges to make sure that we drive forward a change to how we deliver care by the 23rd of December.
So I'm just going to finish off on telling you about a Health Innovation Week that we're having in November in Ireland. As Richard spoke earlier on, we're doing a hackathon for bipolar, but the area I want you to look at is our Innovation Showcase, which is on the 22nd and the 23rd of November. And this really is our way of trying to get digital health at the heart of the national agenda. It's something we're really, really passionate about, and it's trying to get public awareness about what's actually happening in eHealth. So we're working with academic institutions, we're working with Microsoft, we're working with Samsung, to actually show the different technologies that are actually out there at the moment, the different things that are happening in the hospitals at the moment, but also the art of the possible. So Microsoft are bringing HoloLens, Samsung are bringing some really cool VR technologies to let people see the different things that could happen in health in Ireland. We also have some amazing speakers coming to talk for those 2 days on bringing their unique insights on all the different things that are happening in connected health around the world. So something we're really, really proud of, and please follow us on Twitter and our website to try and find out more about our Innovation Showcase, and if anyone can come, you're more than welcome to come to it as well. Thank you.
Thank you very much, everybody.
Thank you.